In 1942, concentration camps began to incorporate brothels where women were prisoners forced to engage in prostitution. It was not a spontaneous phenomenon, nor informally tolerated. It was a planned decision from the center of the regime and implemented in multiple installations of the system. Access to the service was not free. Only some inmates could enter with prior authorization. Women were transferred from Ravensbrück, examined by SS doctors and assigned according to their physical capacity. Each encounter was carried out under supervision and was recorded in the camp's archives. What function did this mechanism fulfill within the camp structure? Why was sexuality incorporated as part of the disciplinary system? And what does its existence reveal about the level of exploitation reached by the Third Reich? Architects of forced pleasure, SS planning and sexual control. In 1942, the Third Reich's concentration system was subjected to an internal review aimed at optimizing its operational performance. The progressive deterioration of productivity in key camps such as Sachsenhausen, Buchenwald and Mauthausen motivated the SS Economic and Administrative Main Office, WVHA, to introduce new forms of social and disciplinary control. Reichsführer SS Heinrich Himmler, together with Oswald Pohl, head of the WVHA, promoted a measure that combined economic, sanitary and hierarchical objectives, the creation of controlled brothels within the camp perimeter, administratively defined as special structures or Sonderbauten. This directive was the result of technical discussions held between sections D and F of the WVHA, with additional participation from the SS Health Office and the Race and Settlement Department. Its planning did not obey isolated demands nor logistical emergencies, but rather a structured intention to reorganize the internal life of the camps through selective gratification mechanisms. The formal justification of the measure was supported by periodic reports prepared by the camp administration officers. These documents indicated a constant decline in labor performance indices, accompanied by incidents of indiscipline and the proliferation of homosexual relationships among prisoners. Homosexuality was not considered a moral deviation from the perspective of the concentration bureaucracy, but rather a factor that compromised the hierarchical system, generated parallel bonds of loyalty among inmates and destabilized supervision. In the WVHA analyses, sexual administration should align with the same technical criteria that regulated the use of labor force, feeding and space. Sexuality was, consequently, formally incorporated into the camp's resource system. The model designed by the WVHA was conceived to be uniformly applicable in all camps considered suitable for its implementation. The physical design of the Sonderbauten consisted of segmented barracks with rudimentary internal divisions, doors with external control, absence of interior locks, scarce artificial lighting, and passive surveillance points from lateral corridors. These characteristics were not improvised nor dependent on the local commander's criteria, but rather came from standardized plans sent from Berlin. It was anticipated that each compartment could be used successively by different users in strictly regulated periods, optimizing available time and allowing direct control over the encounter's duration. Spatial planning should also contemplate its location within the camp. It should be located close to work areas to facilitate controlled transfers, but sufficiently isolated from common residential blocks to avoid internal friction, visual contact, or interference in the disciplinary routine. The selection of female personnel destined for these spaces was entrusted to the Ravensbrück camp, which had already operated as an exclusive concentration center for women since 1939. The orders issued by the WVHA specified that the prisoners should meet a series of physical and sanitary conditions determined by SS medical personnel. The required profile included women between 20 and 35 years old, preferably German or Western European nationality, intact reproductive health and physical state that would allow them to sustain a high number of daily encounters without medical interruptions. Women diagnosed with venereal diseases, visible injuries, or signs of physical weakening were rejected. Also excluded by norm were all those classified as Jewish, Roma, or belonging to categories considered biologically undesirable in accordance with the regime's racial policies. The assignment process began with a formal request sent by the receiving camp commander to the WVHA, which validated the quantity of women required based on the population of inmates authorized to use the service. Once the request was approved, Ravensbrück performed the medical and preparatory selection, after which transfers were organized by train guarded by armed personnel with detailed records of each transfer. Each woman's documentation contained photograph, identification number, recent medical evaluation, disciplinary history, and block of origin. This documentation was archived both in Ravensbrück and in the receiving camp's medical administration, allowing complete traceability during the assignment period. The men authorized to use the brothel were functional prisoners, block leaders, work supervisors, or individuals rewarded for exceptional performance. Access was limited by productive and racial criteria. Each camp had a control system that validated each user's authorization through registered cards previously validated by block administrators and reviewed by custody personnel at the Sonderbau entrance. The time allowed per encounter was 15 minutes, without possibility of extension or daily repetition. Each entry and exit was recorded with exact time, prisoner's identification number and assigned prisoner's name, generating daily reports sent to the camp's central administration and subsequently to the WVHA. Parallel to the physical and sanitary control of the brothels, a statistical observation system was established aimed at evaluating the operational impact of the measure. Commanders had to report monthly on the effects detected in the labor productivity of inmates with regular access to the service, the frequency of sexually transmitted diseases detected in women, and disciplinary incidents directly or indirectly linked to the brothel's operation. These reports were compared by the WVHA's Office D to determine variations in performance between camps with and without Sonderbau, with the objective of adjusting protocols and evaluating the viability of their expansion. At the administrative level, the brothel system was conceived as part of the same technical structure that regulated forced labor, punishment, feeding, and medical management. There existed in its operation no component that departed from the bureaucratic logic that governed the concentration apparatus. The human body was treated as a fragmented productive unit. Its labor force was measured, its reproductive capacity was monitored, its sexual behavior was channeled, and its emotional bonds were interrupted through isolation, separation, and surveillance. The spaces destined for the brothel were built with materials identical to the barracks, bed linen was numbered and rotated according to the usage calendar, and furniture was the minimum indispensable to allow rapid mechanical and repetitive use. The program was monitored in each of its phases by different SS departments. The health office supervised the health status of assigned women with weekly reviews to detect infections. The Race and Settlement Department reviewed the racial and medical profiles of those selected and confirmed their compatibility with ongoing eugenic policies. The WVHA coordinated the resources assigned to each installation, processed monthly performance reports, and proposed adjustments in assignment and rotation quotas. This vertical structure guaranteed that each Sonderbau functioned with operational precision, without margin for improvisation or local autonomy. Existing documentation demonstrates that the system was executed with the same level of scrutiny as other Central Reich operations. Printed forms, transport lists, medical reports, and productivity evaluation sheets were archived in duplicate in the camp offices and in the WVHA's central archives. This operational traceability allowed maintaining control over the circulation, utilization, and performance of the prisoners involved, as well as recording in detail the disciplinary and economic impact of the project. There exists in known documents no indication that the program was improvised or the result of autonomous decisions in the camps. Everything indicates that it was conceived from the beginning as a stable component of the concentration system at the same level as the quarries, workshops, or punishment blocks. The creation of brothels in the camps did not represent an administrative exception, but rather a rational expansion of the principles that governed the entire Nazi repressive apparatus. Its function was structural: to reduce internal tension, increase efficiency, punish deviation, and reward obedience. Sexuality was reduced to a manageable variable, aligned with the control and exploitation objectives that defined the system's architecture. The master experiment Mauthausen and the birth of the Sonderbau. In mid-1942, the Mauthausen camp in Upper Austria was designated as the initial point for implementing the first brothel of the Nazi concentration system. This selection was not random nor the result of local urgencies, but a decision based on institutional logic. Mauthausen, operational since 1938 and characterized by extremely severe conditions, served as a space for administrative experimentation due to its high labor load, its controlled internal composition, and its logistical proximity to Linz, where key WVHA units operated. The harshness of its regime, centered on forced labor in granite quarries, made it an optimal scenario for evaluating new disciplinary measures under extreme exploitation conditions. The construction of the Sonderbau was executed by the camp's technical department according to standardized plans sent by Berlin. A barracks located next to work areas but isolated from accommodation blocks was assigned, thus fulfilling the requirements of controlled accessibility and functional segregation. The interior design reflected a structure designed for rotative efficiency, individual compartments of minimal surface, dim lighting, artificial ventilation, and entrances with exterior opening mechanisms. The internal divisions lacked physical or acoustic isolation, but offered partial visual separation. Along the central corridor, openings for external surveillance were enabled, allowing guards to control usage times and detect any non-compliance. Each unit was conceived for programmed rotations with predefined times. The operational standard established a duration of 15 minutes per encounter, allowing an average of 30 to 40 daily users per prisoner. This mechanics followed the same efficiency principles applied to industrial work lines. Supervision fell to male camp personnel, instructed to maintain written records, observe possible deviations, and guarantee strict compliance with shifts. Access was limited to prisoners with formal authorization. Each inmate had to present a request validated by the block leader and approved by the corresponding administrative officer. The authorization was registered and archived. Visit schedules were organized in functional blocks, morning, evening, and night sessions, with intermediate times destined for cleaning, disinfection, and personnel rotation. This logistical scheme sought to maximize service availability without interfering in the camp's general work calendar. The women selected to provide service in Mauthausen were extracted mainly from the Ravensbrück camp. Their selection obeyed criteria established by the Race and Settlement Office and validated by the SS Medical Department. The prisoners were subjected to clinical examinations, gynecological reviews, and physical resistance tests. The prioritized profiles were women between 20 and 35 years old, with low disciplinary backgrounds, accepted ethnic origin, and adequate bodily capacity to withstand intensive rotations. Exclusions were systematically applied to Jewish, Roma women, or those considered racially inadequate. Once approved, those selected were subjected to a preparatory procedure that included baths with chemical solutions, exposure to artificial light, reinforced caloric feeding, and application of standard cosmetic products. All this treatment was recorded and justified as preventive hygienic protocol. Once in Mauthausen, the women were subjected to a final medical inspection and classified according to their operational capacity. Those who did not meet expectations were returned to Ravensbrück or reassigned to forced labor sections. Those assigned to the Sonderbau were registered with internal code and monitored weekly by sanitary personnel. The operational load was calculated based on the camp's density and projected demand, between 6 and 10 daily users per woman in days divided into time slots. Supervision also included control of service time, personnel rotation, and basic medical monitoring. Usage authorization was limited to a group of between 300 and 500 prisoners weekly, whose selection was reviewed periodically by block leaders. The service was formally regulated by a system of cards and internal documents, and access was monitored at fixed control points. Surveillance was in charge of an SS unit designated exclusively for that function, which included officers, sanitarians, and administrative auxiliaries. Record sheets were maintained with exact times of entry and exit, user identification, and disciplinary observations, if any. The prisoners were subjected to weekly medical reviews with emphasis on detecting venereal infections. Those who presented symptoms were isolated from service, treated basically, and subsequently returned to the camp of origin or reassigned according to availability. Personnel rotation was carried out every 4 to 6 weeks. This practice sought to maintain operational performance, avoid irreversible physical deterioration, and facilitate the implementation of comparative evaluations. The first reports, prepared by Mauthausen's administration and sent to the WVHA, indicated an improvement in the labor performance of frequent Sonderbau users. Statistics showed reduction in internal conflicts, fewer reports of aggressions, and a documented decrease in homosexual relationships, categorized as functional deviation by camp officers. This data was interpreted by the WVHA as initial success of the pilot program, which led to requests for immediate replication in other camps. The Mauthausen case was considered by the administrative leadership as conclusive operational proof. The documentation generated during the first 3 months of operation was used as reference in internal circulars to plan the installation of Sonderbauten in Buchenwald, Flossenbürg, and Sachsenhausen. Plans, material lists, registration formats, and medical protocols were replicated. The initial experience also served to adjust shift duration, rotation frequency, and load limits for each woman. Mauthausen was, consequently, the starting point of a systematic policy. It was not an operational exception nor a local measure, but the trial of a replicable institutional model. The Sonderbau installed in its facilities functioned as a functional laboratory whose variables were analyzed, documented, and compared with objectives defined from the SS Administrative Center. Sexuality, managed as a disciplinary variable, was treated with the same efficiency logic as work, punishment, and feeding. The Mauthausen experience not only validated the model but legitimized it as a stable part of the Nazi concentration apparatus. Expansion of the model, 10 camps with brothels. After the favorable evaluation of the results obtained in Mauthausen, the WVHA leadership initiated a phase of institutional replication of the brothel model, this time on an interregional scale. Starting in 1943, with Himmler's express approval and under direct supervision of Oswald Pohl, the systematic installation of Sonderbauten was ordered in the main concentration camps of the Reich. The directive was based on criteria of structural uniformity, operational standardization, and logistical viability, considering variables such as population density, productive performance, disciplinary profile, and proximity to industrial nodes. The deployment began with Buchenwald, which inaugurated its installation in June 1943. The units were adapted to the pre-existing building structure, with location close to assembly workshops and monitored access routes. In Sachsenhausen, the Sonderbau was established next to the SS Stab building, which allowed direct supervision from the camp's administrative center. In Flossenbürg, it was integrated into the granite quarries bordering areas, maximizing control over workers assigned to high physical wear tasks. Dachau incorporated the model in May 1944 through the remodeling of an already existing block, while in Auschwitz, 2 installations were established. One in Block 24 of Auschwitz I and another in Monowitz next to IG Farben's industrial plants. The expansion was completed with the activation of Sonderbauten in Gusen, Neuengamme, Natzweiler, Struthof, Mittelbau, Dora, and Majdanek. Each of these implementations responded to requests elevated by local commanders to the WVHA, justified by internal control needs, indiscipline problems, or productive stabilization requirements. The instructions issued from Berlin included specifications on construction materials, ventilation systems, dimensions per compartment, and isolation and supervision parameters. Operation manuals were distributed with detailed descriptions of hourly rotation, sanitary supervision, SS personnel assignment, and monthly report format. These manuals also contained directives on procedures for structural failures, temporary closure protocols in case of sanitary outbreaks, and incident report models for disciplinary incidents. In all cases, access was limited to specific hierarchical subgroups: capos, block leaders, workers with exceptional performance, and some internal administrative collaborators. This exclusivity fulfilled functions of indirect disciplining and reaffirmation of intra-camp hierarchy. User selection was reviewed weekly, and permits were managed through numbered, sealed, and controlled cards at fixed points. Administrative records detailed each entry, exact time, user code, and observations, being archived for 6 months for internal evaluation. These archives were contrasted quarterly with the camp's medical department reports to detect anomalous patterns or deviations. The days were organized in 3 time slots: morning, evening, and night, with intermediate slots for cleaning and inspection. Each encounter was limited to 15 minutes, and no prisoner could access more than once per day. Assigned prisoners had to fulfill between 8 and 10 daily services, with programmed rotations every 4 to 6 weeks, depending on physical state. The responsible SS personnel verified punctuality, permit authenticity and rotation compliance, preparing daily reports that were sent to the commander's adjutant and the camp's chief physician. In certain camps, parallel control sheets signed by users were implemented to reinforce system traceability. The sanitary component was supervised by medical personnel subordinated to the SS Health Office. Mandatory weekly reviews, basic clinical tests, and venereal infection records were performed. Sick prisoners were separated and treated with limited resources. If they showed no improvement within established deadlines, they were returned to the camp of origin or reassigned. Hygiene areas were inspected daily, and any infraction by female users or male users was reported as a disciplinary fault. In some installations, auxiliary sanitary units annexed to the Sonderbau were established to facilitate emergency medical management and isolations. The analysis of operational data generated by these camps evidenced replicable trends. An average increase of 5 to 8% in productivity levels was detected in sectors with greater access to the Sonderbau, and a decrease between 10 and 15% in reports of indiscipline, aggressions, or disrespect to the chain of command. These results were recorded monthly by the WVHA's Statistics Department, which consolidated the perception of the Sonderbau as an effective instrument of internal management. In some cases, camp commanders requested capacity increases or expansion of time slots, petitions that were evaluated based on figures contained in quarterly reports. However, the reports also indicated technical failures. In several camps, cases of premature exhaustion among women, frequent infections, passive rejection from users, or structural deterioration of barracks were documented. In response, the WVHA issued new guidelines to reduce the load per prisoner, intensify medical controls, improve unit ventilation, and reinforce discipline of SS personnel in charge of surveillance. In some cases, operating hours were cut or installations were temporarily closed to make adjustments. Structural durability records were also introduced, with bi-monthly barracks inspections to prevent infrastructure failures that would interrupt operability. In addition to its disciplinary function, the Sonderbau began to be considered also as a space for indirect observation. Responsible officers collected information about atypical behaviors, emotional reactions of prisoners, or non-regulatory petitions. These observations were included in special reports and sent to the camp's security officer with the objective of identifying possible sources of agitation, improper alliances, or latent discontent. The Sonderbau thus came to play a complementary role in psychological surveillance and in monitoring risk behaviors within the concentration system. The extension of Sonderbauten to 10 camps confirms that the program was a deliberate institutional policy and not a spontaneous response to local needs. The manuals, listings, statistical reports, medical reports, and communications between local commandants and central offices demonstrate the existence of a normalized device with defined objectives, performance indicators, and intervention protocols. The brothel, integrated into the concentration apparatus, was exploited with the same administrative rationality as slave labor, medical selection, or punishment management. Its serial development was a planned extension of the system's structural principles, oriented toward total dominion of behavior, body, and productivity under permanent surveillance. Marked women, Ravensbrück, and the logistics of exploitation. The Ravensbrück camp, inaugurated in 1939 as an exclusive complex for women, operated as a logistical center for selection, preparation, and distribution of prisoners destined for brothels in concentration camps. This function was officially assigned by the WVHA and regulated through internal directives that established standardized medical, administrative, and operational parameters. The procedure left no margin for local initiatives nor contextual variability. It was a structure planned from Berlin, executed in series, and evaluated through cross-referenced records. The central component of this operation was the instrumentalization of the female body under functional use logic, with exclusively productive criteria. The selection was initiated through formal request from the receiving camp, sent to the WVHA with specification of quantity of women, destination camp, and justification based on volume of authorized users. Once the request was approved, Ravensbrück activated the screening process. This consisted of a complete medical evaluation with review of general physical state, weight control, gynecological inspection, tests for contagious diseases, and functional mobility check. Everything was performed under supervision of SS medical personnel, with results archived and validated by signature. Prisoners with signs of tuberculosis, infected lesions, evident muscular weakness, or acute malnutrition were automatically discarded. The approach was not therapeutic but operational. Bodies capable of withstanding rotative shifts without interruptions were sought. No improvement treatments were implemented to try to recover discarded prisoners. Those who met the requirements passed to a second selection stage based on behavioral aspects: internal disciplinary history, obedience records in assigned tasks, and subjective disposition observed by personnel. Although no formal psychological protocol existed, reports included annotations about perceived docility, level of cooperation, absence of conflicts with other inmates, and degree of adaptability. Women with backgrounds of indiscipline, resistance, defiant language, escape attempts, or interventions in internal protests were excluded. The selection aimed to guarantee a functional, predictable, and maneuverable contingent. Finally, approved prisoners were registered as Sonderverwendung, special use, and were assigned a new file with technical sheet, frontal photograph, block of origin, selection date, and assigned destination. This file was duplicated. One copy remained in Ravensbrück, another was sent to the receiving camp's administrative department. Prior to transfer, those selected entered a conditioning protocol of between 7 and 14 days. During that period, they were administered a calorie-enriched diet composed of white bread, concentrated soup, oatmeal porridge, and controlled portions of animal fat. The objective was not to improve their general health, but to modify their external appearance. Chemical baths with anti-parasitic solutions, sanitary haircuts, and skin treatments with basic ointments were also applied. Some prisoners were exposed to artificial light or low-intensity ultraviolet radiation to alter epidermal coloration. These practices, documented in internal manuals, were classified as hygienic functional preparation. Transport was carried out in reduced batches, usually between 8 and 15 women, transferred by rail in adapted wagons. The route varied according to destination, but in all cases it was escorted by armed personnel and registered in transit documents. Conditions were severe but differentiated from those of mass deportee transport, not due to humanitarian attenuation but due to logistical necessity. It was sought that women arrive in physical conditions suitable to begin their service without delays. Upon arriving at the receiving camp, women were received by sanitary and administrative personnel who verified documentation and performed an admission medical inspection. If any prisoner presented symptoms of infection, serious bodily deterioration, or internal lesions, she was immediately returned to Ravensbrück or destined to alternative forced tasks. Those accepted were relocated to special barracks or temporary isolation areas until their formal incorporation into the Sonderbau. Each received an internal code, standard uniform, and a medical card that was updated weekly by the local sanitary team. The service period was limited. On average, prisoners assigned to the Sonderbau fulfilled cycles of between 4 and 8 weeks, depending on physical state, workload, and sanitary evaluations. Women who developed venereal infections, extreme exhaustion, or inadequate behavioral manifestations were relieved before the end of the cycle and substituted by newly selected ones. Rotations were planned monthly, with support from reports sent from receiving camps to the WVHA and to Ravensbrück. Re-evaluation mechanisms also existed. Some women were reincorporated to service after short periods of rest or treatment, provided they again met established criteria. Motives for definitive exclusion included diagnosis of incurable venereal diseases, loss of body mass below the functional limit, psychiatric collapse episodes, or development of defiant attitudes toward personnel. These conditions were certified by the receiving camp's sanitarians and communicated to Ravensbrück through technical reports, which were archived for future internal audits. The entire process was strictly documented. Exit lists, transfer records, reception forms, sanitary sheets, operational use records, and monthly evaluation reports were maintained. This information was consolidated quarterly by the WVHA to cross-reference data between camps, verify program efficiency, and adjust selection criteria or load parameters. Complete traceability of each prisoner's body was a functional requirement, not a formality. It was managed as a physical resource in transit, evaluated, exploited, and substituted according to performance needs. This system of selection, transfer, use, evaluation, and withdrawal contained no spaces for individual initiative nor subjective modification. Each phase of the process was defined by the central administrative apparatus, with local camps acting as executing units. Women had no possibility to refuse, intercede, or request exceptions. Their function was determined exclusively by operational criteria imposed from the concentration system's summit. Assignment to the Sonderbar was not perceived as improvement nor as punishment, but as functional designation under total biological exploitation logic. The existence of a regular flow of women between Ravensbrück and receiving camps, coordinated through requests, inspections, duplicated files, and comparative evaluation mechanisms, demonstrates that the use of women in camp brothels was not marginal nor discretionary. It was a centralized operation, documented, sustained for at least 2 consecutive years, and linked to the general logic of body administration in the Nazi system. Each transfer, each cycle, each discharge, and each reincorporation were pieces of machinery designed to convert the female body into one more tool of control, surveillance, and discipline within the concentration apparatus. Matrices of the Reich controlled reproduction. Within the general framework of control over the female body exercised by the regime, women considered Aryan who maintained relationships with soldiers or SS members, whether inside or outside the camps, could be referred to the Lebensborn project if they met the required racial criteria. Children born from these unions were evaluated and, in case of meeting the required phenotypic conditions, incorporated into the system as biological assets of the Reich. Officially established on December 12, 1935 under Himmler's direct patronage, Lebensborn constituted a systematic policy to foster natality among women considered racially valuable according to National Socialist biological criteria. The name Lebensborn, source of life, reflected its central objective: to increase the pure Aryan population through planned reproduction of individuals who met specific criteria of the racial ideal: light skin, light eyes, verifiable Germanic ancestry, and optimal physical health. The program responded to concern about the decline in natality among population considered genetically superior. The project was based on 2 strategic pillars: the promotion of racially pure births, even outside conventional marriage, eliminating the stigma of illegitimacy when the mother was classified as Aryan and the father belonged to the SS or racially approved organism; and state protection with supervised upbringing, ensuring education according to National Socialist values and integration into the Reich's racial project. One of its central components was the institutionalization of state tutelage over children born outside marriage. The system eliminated social stigma under purely racial logic. If both progenitors met established biological criteria, the state intervened to guarantee birth, medical attention, and official registration of the child as racial asset. Pregnant women received material support for delivery and postpartum in Lebensborn houses, with lodging, reinforced feeding, and specialized medical attention. In many cases, the biological father was not formally identified, but if the mother met racial criteria, the child could equally be registered as valuable, and the regime assumed different degrees of legal custody. This policy pursued pragmatic objectives to avoid abortions among single German women who had conceived with SS or Wehrmacht members, eliminate the social shame of pregnancy outside marriage, and reconfigure reproduction as a state function disconnected from traditional morality. Lebensborn houses were medical residential installations established in German territory and subsequently in occupied countries. It is estimated that at least 10 houses operated in Germany and several more in territories such as Austria, Norway, Belgium, and France, all following a uniform institutional model with defined medical, administrative, and reproductive functions. The personnel comprised doctors and gynecologists responsible for prenatal control, delivery, and genetic evaluation of newborns, nurses trained in National Socialist ideology for basic care and monitoring of physical state, and SS administrators who managed records, authorized births, organized adoptions, and reported statistics to central management. These installations maintained discreet but constant surveillance. They did not present an openly repressive character like concentration camps, given their strictly reproductive and demographic objective. However, admitted women lacked real autonomy over fundamental decisions related to their pregnancy or their children's subsequent destiny. After birth began the process of institutional evaluation and frequently separation. Although officially defined as voluntary, in practice it operated through combination of administrative pressure, ideological conditioning, and economic dependence. Mothers were systematically induced to deliver their children for state upbringing under argument of guaranteeing a secure and racially optimal future. Each newborn was examined following a standardized protocol of phenotypic and medical evaluation, meticulously assessing skin, eye and hair color, cranial and facial proportions, motor reactions and vitality, and absence of congenital diseases or signs considered of racial degeneration. Children who met these criteria were officially registered and could follow two routes: be raised in the institution itself under supervision of specialized personnel, or be delivered for adoption to certified German families, particularly childless marriages linked to the SS or the Party. In both cases, the state maintained legal authority over fundamental aspects: official identity, education, place of upbringing, and eventual utilization within the state apparatus. If the newborn did not meet racial criteria, it could be separated and destined to common orphanages or regular medical institutions. In documented cases of disability diagnosis or suspicion of hereditary degeneration, some neonates were classified as non-viable and eliminated through infantile euthanasia programs, although these practices were recorded in limited form. Admitted women were treated fundamentally as reproductive vehicles. Their personal development was not fostered beyond their maternal function. Their institutional purpose was to gestate, give birth, and, if circumstances required it, separate from the child, who came to be considered biological resource of the Reich. This logic was applied independently of personal ideological affiliation. The determining factor was exclusively the perceived genetic value according to racial parameters. The policy promoted a model of racialized maternity, where the Aryan woman's uterus was conceptualized as a state instrument for production of future German soldiers, leaders, or colonists. Those who delivered several children to the state could receive recognitions such as the Mother's Cross, Mutterkreuz, symbolic distinctions, or limited material benefits. In certain contexts, participation also offered protection against marginalization traditionally associated with motherhood outside marriage. The project expanded to occupied territories, especially Norway, where thousands of women were incorporated after conceiving children of German soldiers. In countries such as France, Belgium, and the Netherlands, it functioned as a mechanism of child appropriation and suppression of national identities. Frequently, children were transferred to Germany, rebaptized with Germanic names and raised as German citizens, deliberately eliminating links with their biological origin. Lebensborn represented an institutionalized form of biological engineering and state reproductive control. Its structure was simultaneously medical, administrative, and racial, without space for autonomous affective bonds or independent personal decisions. The woman classified as Aryan was reduced to her reproductive capacity and managed by a bureaucratic apparatus that evaluated, classified, and utilized children according to their perceived racial potential. Surgeons of horror, laboratories in concentration camps. During World War II, the SS institutionalized a medical experimentation program that directly affected thousands of female prisoners in concentration camps. These practices, executed under scientific appearance, focused specifically on control of female reproduction, intervention in fertility, and manipulation of sexual behavior. The transformation of concentration system prisoners into subjects of forced investigation was not the result of individual excesses, but of a systematic program backed by specific departments of the Nazi apparatus and documented with bureaucratic precision characteristic of the regime. Josef Mengele, with doctoral training in anthropology and medicine from the University of Munich, emerged as a central figure in these programs when designated official physician of the Auschwitz camp. There he developed an extensive program of reproductive control, forced inseminations and studies on twins using Block 10 as operations center. This building, originally designed as basic infirmary, was transformed into an experimental laboratory with specific resources assigned by central administration. Mengele did not act as an independent researcher, but as a functionary fully integrated into the administrative structure, with access to priority selection of prisoners and complete documentary support for his procedures. Karl Klauberg represents another paradigmatic figure in Nazi reproductive experimentation. Prestigious gynecologist before the war and active party member, he received direct authorization from Himmler to develop methods of non-surgical mass sterilization. His characteristic technique consisted of injecting formaldehyde-based substances directly into the fallopian tubes without anesthesia nor adequate aseptic conditions. The procedure provoked severe inflammation and permanent scarring, resulting in irreversible sterility. The brutality of the method was rationally calculated. It allowed processing greater number of women daily than through conventional surgery, thus responding to the program's administrative efficiency objectives. Sexual and reproductive experimentation had support from three key institutions that provided legitimation at different levels. The Ahnenerbe, Official Institute of Archaeological and Racial Research of the SS, founded in 1935, provided racial theoretical framework and pseudo-scientific justification, integrating experimental results into its ideological corpus on biological hierarchies and racial purity. The Reich Ministry of the Interior, in charge of official demographic policies, facilitated administrative and legal coverage, defining suitable and unsuitable populations for reproduction according to explicit racial criteria. The Kaiser Wilhelm Institute, prestigious international scientific center, contributed with investigative methodologies and academic validation, transforming brutal procedures into apparent medical advances through scientific terminology and formalized protocols. The reproductive control methods implemented in the camps combined administrative efficiency with extreme physical brutality. In addition to Klauberg's sterilizing injections, experimental surgical interventions without anesthesia were practiced, partial or total extirpations of ovaries, uterus, and tubes performed in minimal sanitary conditions, frequently by personnel with limited medical training. These operations generated mortality and serious complication rates deliberately documented as experimental data on tolerance and bodily resistance of different ethnic groups to invasive procedures. In Buchenwald, particularly in Block 46, another experimental line centered on hormonal treatments was developed. Prisoners received injections of compounds derived from animal glands, mainly bovine and porcine testicles, designed to alter hormonal patterns and reproductive functions. These procedures sought both sterilizing effects and sexual behavioral modifications, particularly suppression of sexual impulses in populations considered undesirable. The administered doses deliberately exceeded established safety thresholds, generating severe endocrine imbalances meticulously documented as differentiated responses according to ethnic origin. The installations where these experiments were performed were specifically conditioned within the camp's architectural structure. In Auschwitz, Block 10 was completely reorganized as Reproductive Experimental Center, with physical separation from the rest of the camp through additional wire fencing and restricted access even for regular SS personnel. The interior contained exploration rooms, basic gynecological tables, chemical preparation areas, and spaces for post-intervention observation. The design prioritized efficient processing of experimental subjects over basic sanitary considerations, reflecting the purely instrumental conception of victims. In Ravensbrück, Klauberg adapted sections of the infirmary for his procedures, installing injection equipment and restraint systems to immobilize patients during interventions without anesthesia. The rooms maintained disposition that allowed sequential processing of multiple women, with minimal recovery areas where complications post-procedure were observed and documented as additional experimental data. The very architecture of these spaces materialized the mechanistic vision of the female body as experimental object. The experimental program's objectives were explicitly documented in internal communications between departments. The immediate purpose consisted of developing efficient methods to eliminate reproductive capacity of populations considered racially undesirable, Jewish, Roma, Slavic, according to Nazi biological criteria. More specifically, techniques applicable massively were sought without requiring complete hospital installations nor highly specialized medical personnel, allowing implementation in occupied territories with limited resources. A secondary but significant objective was generating comparative data on racial differences in response to reproductive interventions. Doctors meticulously documented recovery times, complication rates, and resistance to procedures according to ethnic origin, constructing pseudo-scientific bases for racial superiority theories. This investigative dimension provided academic justification for procedures that, essentially, constituted institutionalized forms of sexual and reproductive violence. The third objective, particularly relevant in advanced phases of the conflict, was to develop covert sterilization methods that could be applied without the victim's knowledge. Klauberg worked specifically on substances that, added to food or water, would provoke infertility without immediately detectable symptoms, allowing implementation in civilian populations of occupied territories as part of long-term demographic policies. These investigations revealed the genocidal dimension of the program, conceived as a tool for gradual elimination of ethnic groups through suppression of their reproductive capacity. The selection of experimental subjects followed precise administrative protocols. SS medical personnel regularly visited prisoner blocks to identify candidates according to specific criteria: reproductive age, generally between 20 to 40 years, sufficient physical condition to survive procedures without anesthesia, absence of infectious diseases that could contaminate experimental results, and belonging to specific ethnic groups required for comparative studies. Those selected were registered with special codes in administrative documentation and transferred to experimental blocks through official orders that rarely specified the true purpose. The victims generally were unaware of the real nature of the procedures. They were told they would receive regular medical treatments, gynecological reviews, or even false promises of possible liberation after participation in special programs. This deliberate misinformation fulfilled a double purpose: reducing initial resistance and allowing evaluation of sterilizing effectiveness without the affected women's knowledge, thus validating methods potentially applicable secretly to broader populations. The practical implementation followed standardized sequences. After initial selection, women were subjected to complete physical examinations to document reproductive state prior to intervention. The experimental procedures proper followed: injections, surgeries, radiological or chemical treatments, performed without consent nor adequate anesthesia. Subsequently, basic medical monitoring was implemented, not oriented toward patient well-being, but toward documentation of effects and complications. Finally, after variable periods, weeks or months, confirmatory examinations were performed to verify effective sterility. The generated documentation was meticulous and exhaustive. Each case produced individual files with photographs, anthropometric measurements, prior medical history, detailed description of applied procedure, immediate complication record, and final effectiveness evaluation. These files were centrally archived, generating comparative databases on methods and results. The documentary precision contrasted dramatically with the procedure's brutality, exemplifying the coexistence of bureaucratic rationality and extreme dehumanization characteristic of the Nazi system. The exact quantitative scope is difficult to establish due to partial destruction of records during the war's final phases. Nevertheless, preserved evidence and subsequent testimonies allow estimating that at least 700 people were directly subjected to these procedures. In Auschwitz, Klauberg's experiments included hundreds of women. In Ravensbrück, documentation indicates more than 140 prisoners transferred for experimental purposes. In Buchenwald, dozens of prisoners participated in hormonal treatments. The mortality rate oscillated between 15% and 30%, institutionally accepted as part of the investigative process. The deceased were autopsied to collect additional samples and feed other study lines. The physical and psychological consequences were devastating. Survivors faced irreversible sterility, chronic pain, recurrent infections, and severe hormonal disorders. Psychologically, the loss of reproductive capacity, procedures performed without anesthesia, and systematic deception generated profound traumas that lasted decades. Many developed post-traumatic stress disorders, dissociation, chronic anxiety, and difficulty reintegrating into social life after liberation. Despite the crime's gravity, many responsible parties did not face justice. Mengele escaped and was never captured. Klauberg was imprisoned by the Soviets but died before facing trial in West Germany. Numerous implicated doctors resumed their careers after the war. The magnitude of impunity highlights the necessity of keeping historical memory alive. The Third Reich's reproductive experiments represent one of the darkest aspects of using science as an instrument of violence. They were not individual errors nor marginal excesses. They were integral part of a state machinery determined to transform human reproduction into a tool of biopolitical control. The documentation of these facts not only honors the victims, but constitutes a crucial reminder of the dangers of allowing science to subordinate itself to genocidal ideologies.